Order. I call on Richard Fuller to move the motion.
Thank you very much indeed, Mr. Betts, and it is a pleasure to serve under your chairmanship. And I would beg to move the motion of access to GPs and primary care in North East Bedfordshire. And it's a pleasure to welcome the Minister to her place. The reasons for this debate, Mr. Bates, essentially were two of the main commitments that I made when I stood for election in 2019. It was to promote access to local services and to maintain the rural character of North East Bedfordshire in the light of high levels of persistent housing development that stretch back over a number of years. And these issues are related, but there are certain also distinct resolutions for each. And what's informed me in calling this debate is over the last 6 months, I have spent quite a considerable amount of time speaking to GPs and staff in primary care across my constituency. I have listened to their points of view, I've analysed some information from their practices, and I'd like to start by commending the work of our GPs and their staff, most particularly in the period coming through COVID. I'm going to touch on some of those concerns that I had for how GPs were feeling and the morale through that period when I talk a little bit about the response that I've had in my email inbox from constituents. It's also informed by prior debates on the impact of development and population on access to health services, GPs, and indeed to dentists, which isn't the primary focus today. I participated in debates held by my honourable colleague, the member for Waveney, and my honourable friend and colleague, the member for South West Bedfordshire. But my inbox has been really rather full of emails from constituents on the issue of access to GPs. And I know this will be known to the Minister, but I always think it's useful for ministers to hear directly from constituents. So I'll briefly quote three. One constituent writes, "My wife is 75 and in acute pain. She can barely walk. Several days last week and yesterday she has been attempting to see a GP. She phones at 8 a.m. and eventually gets through some 2 hours later. She is then told there are no appointments remaining that day and that she should phone the next day at 8 a.m. to try again. The same pattern is repeated day after day, hours and hours spent listening to a recording message with zero result." And another constituent writes to say, "I'm writing to you about the absolute terrible healthcare centre. I phoned the surgery 3 times last week to be told they have no appointments. This is disgraceful. I rang again today to be told no appointments available again and told to phone 111. Apparently they have phones to hold appointments for 111 to allocate. I called phone 111. She told me to go A&E and sit there for hours on end to see a doctor." And a third constituent. "I tried phoning the practice at 8 a.m. as told to me in order to arrange a telephone conversation. For about 50 minutes, the dialing tone cut off with a message saying the line was overloaded. Thus, redialing over and over again was necessary, not something it is pleasant to do when feeling unwell. Eventually, you may get through to be told you're in a queue. When you finally get through to a receptionist, you're told that GPs are only taking emergency calls. When querying what should I do now, I was told to try again tomorrow at 8 a.m. These issues, I think, to a certain extent, are part of the recovery from COVID, the post-COVID period, but they also highlight some issues of concern more generally. And I think the Minister must recognise the irritation of the requirement for my constituents to repeat a process in order to do something as simple as seeing someone in primary care for their health needs. And that there is a further irritation when there has been a pressure in terms of the ability to find an appointment within a reasonable amount of time. This also has a significant impact on morale of staff at GP practices, because the concerns people have in getting through, when they get through, quite naturally people are at a rather heightened level of irritation, and often that has spilt over into abuse of staff. And I know the Minister will agree with me that there is never any rationale or reason for any of us to abuse or be abusive towards staff who are trying to do their best at GP practices. I'd like to share some data with the Minister about my area. So as of April 2021, in terms of patient to GP ratios, My clinical commissioning group area, which covers Bedfordshire, Luton and Milton Keynes, ranked 8th highest out of 106 clinical commissioning groups at 2,169 patients per GP, against an average last year of 1,772. Now, I've looked at data running back to 2014, and I'm grateful to the local medical council for helping me with this. From 2014 to 2022, the list size for GPs in my constituency, a subset of the clinical commissioning group area, grew 13% compared to an 8% growth nationally. So we're growing faster than other areas of the country, quite considerably so. Now let's look at the personnel. For the same period, 2014 to 22, the total headcount of qualified GPs grew 2.1% nationally, but fell 2.2% in North East Bedfordshire. And over that 8-year period, the number of GP partners fell by over a quarter. Now, these staffing numbers are troubling. So consequently, in my constituency, so not the CCG, which is 2,169 patients per GP, but for those practices serving my constituents, the number is 2,482 patients per GP, up 28% in 8 years. And I would point out to the Minister that housing growth in my constituency is already 3 times the national average. This is a problem that is not going to go away. This is not an issue that is going to stay the same. This is an issue which is going to get worse. So maybe I can go through some of the specific findings from my discussions with GPs. The first, I think, is fairly obvious. GPs and I myself and my constituents think that primary care in North East Bedfordshire is under severe strain. One GP told me that, quote, "The vulnerability of the service provided by GPs in my area was off the scale large." I believe my constituency is actually a test case for our manifesto, the Conservative manifesto commitment for infrastructure first. And I would be raising some points about that with the Minister in a minute. GP remuneration systems, in my view, and those of the GPs I spoke to, provide insufficient incentives for GP partners to take on additional responsibilities. If we wish to stem that decline in GP partners, the government's got to show, by words, actions, and remuneration, that it values the additional work that partners take on to provide that broader provision of primary care within their local practice. More generally, for GPs, pay systems provide more reward rather than less reward for those who pick and choose their hours rather than work full-time. And I'd be really interested to hear from the Minister on this issue of locums versus salaried versus partners. What is the government's strategy? What is the government's preference? I can tell the Minister that my personal view is that the partner model is a model that has worked well historically, and in my view is the best model for the future. But I would also tell her that if she agrees with me, then some substantial changes in the way in which remuneration systems work is required. Now, the NHS also provides payments to practices that are based on hitting specific targets set at a national and sometimes local, but usually national level, such as the QOF, Qualities and Outcomes Framework Impact Investment Fund. What I hear is that some of these can be onerous, that the targeted benefit is outweighed by the bureaucratic cost of managing, achieving those targets. And I'm worried that these have a tendency to prioritize bureaucratic target setting and undermine the professionalism and integrity and insight of our GPs. We have to recognize that GP partners are some of the best qualified people in the country. To drive them, Mr. Betts, into little target boxes that they've got to check is in some ways a little bit demeaning for what a GP believes he or she thinks is best for their patients. So I can see there's a need, but I think perhaps the government is overdoing the balance towards bureaucracy. I was intrigued, this is a very minor point perhaps, but to me it sounded quite significant if it's true. I was intrigued when I learnt that GPs cannot create a corporate shield against personal liability when they wish to become a leaseholder of property. Because normally, if you're in a business, for example, and you're a director or a chief executive, your personal liability is not put on the line for a lease that you will sign. I was given the impression, and perhaps the Minister can write to me with an answer to this, is it right that there is no personal liability shield on this issue? Because it seems to me an unnecessary disincentive for becoming a GP partner. Now, increasing the pathways of contact to GPs is significantly underway, from face-to-face to e-consultations to phone consultations. Now, these are currently adding to the frustrations, both of my constituents and also some of my GPs. But there are signs and reasons for hope that this change can be for the better. Some constituencies greatly prefer the opportunity to have a phone consultation. Although 50% of phone consultations require a face-to-face follow-up, 50% do not. And that creates opportunities for scale economies in telemedicine. And one practice which tracks these changes very carefully has been positively encouraged by the reduction in the missed appointments for face-to-face consultation, which is a real saving of GP time. And I would encourage the Minister to pursue further those efforts for new pathways, but recognise that there are teething problems as we broaden out. Similarly, the broadening out of clinical roles, particularly paramedics, nursing roles, and other direct patient care positions in primary care, is generally welcomed by GPs, but they would make the point, and I make it to the Minister, that there does remain patient resistance to seeing someone else other than my GP, even if it's not required, and that it can remain a bottleneck, and also that is not going to be a full answer to the issue of GP access, even in the long term. I also heard that the relationship between primary care and secondary care has become a little fraught post-COVID. I'm not sure it's always been the most harmonious, Mr. Bett, if I'm honest. But has the Minister looked at the additional roles that GPs took on during COVID to relieve pressure on hospitals, to see if that balance is right, if the remuneration is still right, or if there needs to be some clarification on those roles? Similarly, the relationship between GPs and pharmacies, specifically about regulatory intrusion on efficient communication and simple processes such as the issuing of prescriptions. I know the Minister and the government are looking at this, but it seems to me, from what I've heard, that more progress can be made, and that can have a significant benefit in broadening the ways in which people can access primary care. Customer service attitudes and procedures, particularly post-COVID, created widely different outcomes between practices. This really was one of two of the most significant findings I had. It really matters how the practice manager and the receptionist interact with the patients when they arrive or when they get through. And it's interesting how some practices have done a fantastic job and some have fallen short. And so it's just interesting there's such a wide variety. And I wondered whether there was training and protocols about that interaction, that human interaction, to make sure that standards were kept up. And the similar thing, and this is the other thing that was most important, phone systems. Who would have thought that a GP's choice of which phone system would be a critical factor in patient satisfaction with the service they're getting? But I know from my own constituency that there's one particular practice that because they chose system A rather than system B, that has created for them an enormously larger problem with their patients than other practices. Now, the rate of population growth in North East Bedfordshire has been so high for so long, I'm afraid to report that I believe that NHS estates has failed to keep pace with the modernisation of premises, particularly ones that bring individual practices together. And this is going to be my final and key point, really, as part of my asks of the Minister. The slow pace of NHS performance has been further frustrated by inefficiencies of Section 106 and SIL payments. And this is most vividly highlighted in my constituency by the plans for a new surgery to serve the villages of Bindham and Bromham. The land was promised years ago. All of the houses have been built, and yet the building of the new practice hasn't even yet begun. This is a crucial infrastructure-first test case for the future. So North East Beds is already near to the top of the ratios, and population growth at 3 times the national average means the situation is going to get worse without action. So I believe, and I ask the department to look at North East Beds as a test case for our manifesto commitment on infrastructure first, to go back over the last 8 years to identify lessons learned from the inability to keep pace in personnel, in processes and facilities, and to map out what could have been done and what could now be done to improve the situation. I'm asking for a specific test to be done for my constituency of that historical analysis, and I hope the Minister will agree to that today. Practically speaking, I would also ask the Minister to get her department to look at unblocking the jam on the hospital site in Biggleswade. It appears that Treasury restrictions, I think fairly legitimate ones, but nevertheless they're a problem here, are blocking the transfer of this facility so that it can provide GP services in one of the fastest growing towns in my constituency. And I've spoken with Central Bedfordshire Council, and they're willing to fund the rebuild, but they do need some more reassurances and flexibility on long-term use. So please can the Minister talk with her Treasury colleagues to enable progress, as this would be a vital element in relieving the strain. And then similar issues at Great Barford Surgery, which is still located in cramped facilities. Right across the road, there's an available facility. Everyone knows it's the right facility. Everyone's been talking about it being the right facility. Mr. Betts, they've been doing it for years. May I ask the Minister to look at that particular issue and see whether that's an issue that has to resolve locally between the Council and the local clinical commissioning group, or whether the department itself can assist. I have to say, Mr. Betts, in closing, I'm very grateful to our GPs. They have worked sometimes with hostility from their patients, but at all times they have worked, in my experience, in my constituency, exceptionally hard in difficult circumstances, and I'm very grateful indeed to them and their staff.
The question is that this has considered access to GPs and primary care in North East Bedfordshire. Minister to respond.
Thank you, Mr. Betts. It's a pleasure to serve under your chairmanship. And can I thank my honourable friend from North East Bedfordshire for bringing this debate to the Chamber today and raising some really important points about the kind of the good work that's happening, but some of the substantial issues that are facing his local GPs and his constituents. And I'm not going to stand here today and pretend everything's rosy. I want to work with him to address a number of the issues that he raised. But can I just start by, as he did as well, by just thanking GPs and general practices and primary care for all their work during the pandemic and for the work that they're doing now that has increased their workload, whether that's dealing with those waiting on elective waiting lists who need care because they're not able to get their procedures done as quickly as normal, or whether it was through their help with the COVID vaccination booster and dealing with all those patients, almost a tsunami of patients who are now coming forward to seek help when we did advise them to stay away and protect the NHS during the COVID pandemic. In terms of cancer referrals, for example, we're seeing almost 11,000 cancer referrals a day, and each and every one of those come through their GP to get that referral. And just to give some figures, on average, 1.6 million appointments nationally are happening per working day, which is an increase of 5.3% from April last year. And in terms of the COVID vaccination, 62.5 million vaccinations have been delivered by general practices, just to give a scale of the work that's gone on. But I do recognise some of the issues that he has raised. And just to reassure him, I mean, the GPs generally, whether they're salaried or partners, are not directly employed by the NHS. They are independent practitioners who have a business of their own and have a contract to deliver NHS care. And so some of those historical arrangements limit some of the interventions that we can give, and some GPs want more integration than others, and so we have to be flexible in the support that we give. But just to highlight some of the work that we've done, he's quite right in identifying the issue of telephone access, and I know from my own constituents that getting through to the GP is half the battle, and once you've got through, they have usually a very positive experience once they've seen the GP or the other healthcare professionals within primary care. And we did try and help with this in the autumn of last year with the Winter Access Fund. And part of that was that practices could bid for funding to introduce cloud-based telephony systems, which can transform the way appointments can be made. And we know, and he highlighted this himself, that systems where GPs can now see how many people are waiting on the line, how long they've been waiting for, they can divert resources to get calls answered more quickly, and they can even do that remotely with receptionists not having to work directly in the surgery to be able to answer the phone, book appointments, or organise prescriptions. So cloud-based telephony is really transforming it. Unfortunately, some GPs are already signed up to contracts with other telephone providers that they can't get out of. Some have signed up with other cloud-based telephony systems, which, as he indicated so well, are not as good as some of the others. So we are working with GPs. NHS England and Improvement are working to drive full adoption of cloud-based telephony across the system. We're working with those practices, and I think sharing best practice of what really works, because he's quite right, when patients are frustrated when they can't get through, they do take it out on staff, they do take it out on GPs. And so to deal with that issue and be able to make it much more easy to just get through will transform the lives of both patients and staff. And also to bust the myth around this kind of 48-hour appointment model, which was in place under previous governments, where patients had to be given an appointment within 48 hours and then had to phone up every morning and could only get an appointment within that 48-hour window. There is no need for that, and we are trying to say to GP practices, if that's their historical model, they do not need to stick to that. That very often a patient will be happy with an appointment next week rather than have to phone up on the Tuesday, on the Wednesday, on the Thursday and still not get an appointment. So there is a lot of work, as he says, around practice managers and the systems in individual practices that we are very happy to work with GPs to help them with. We're also working around the pharmacy consultation service, which has been used, again, very successfully during the pandemic, where if a patient phones 111 or indeed the GP practice, and there's a range of minor ailments that a pharmacy can deal with, face-to-face, often very quickly and very expertly, and whether that's through to sprains, through to colds and flu, and even those patients on long-term conditions, on long-term medications, such as some diabetics or those with high blood pressure, can be very well managed by pharmacists. And we want to go further with that. We want to introduce more services provided by community pharmacists, and we're in negotiations with pharmacy teams at this very moment to see if we can do that, because in Scotland and Wales they have a pharmacy first system which works extraordinarily well, and we're keen that patients in England have access to similar support as well. We're also introducing changes to the GP contract this year. Some of those are more popular than others, but just for patients in particular, one of the key elements is around extending some of those opening times to evenings and Saturday mornings to make it easier for patients to be able to see their GP if they need to. But it comes on top of the point that he made around other healthcare professionals working in primary care. Primary care is changing dramatically. We already have recruited over 18,000 additional primary care professionals. That's nurses, that's physios, that's pharmacists, that's paramedics, who often better placed sometimes than the GP to provide the care and support a patient needs. But he is quite right. There is a reluctance sometimes, or a feeling from patients that they're being palmed off and instead of seeing the GP that they want to see. But what we're finding is that once they've seen the paramedic or the physio, that they are very pleased to see that a professional the next time an appointment's offered. So we're hoping that the take-up of that will improve, and we have got a commitment to recruit 26,000 more healthcare professionals by 23-24, in addition to the GPs, and we're on track to meet that, so that primary care becomes a multidisciplinary experience for patients, and it isn't always the GP that they need to see first. We do, however, as he says, need more GPs, and we have got a record number of 4,000 doctors who've taken up GP training posts this year, which is, a real boost to numbers, but I recognise very much that they will take several years to be trained and to come through. But in his own constituency, we are, although he does talk very well about the pressure on whole-time equivalents, in his CCG, they do allow GP registrars to also see patients, which does have a boost in terms of appointments for patients and increasing capacity in the local area. He will be pleased to note, though, that the point he makes about housing, and again, my constituency in the South East has similar problems where housing developments are in their thousands rather than their hundreds and spring up overnight with no consultation with the local GP, who then has to take those patients on. That I am meeting with the Housing Minister this month to discuss the very issues he raises about primary care being a key feature when planning is being considered, and when things like Section 106, SIL money, is being allocated, because, as he so rightly says, the health centres need to be built first before the housing. I will give way.
I'm very, very grateful for Minister giving way, and delighted that she is taking such an active interest in this issue of the impact of developmental access to services. In my early contribution, I requested that the department, ahead of my meeting with the Secretary of State, do a look back on that history in my constituency as a test case to see what could have been done differently and what might be done now. Couldn't she commit that that could be done ahead of my meeting with the Secretary of State?
I'm not sure when his meeting with the Secretary of State is. I think it's fairly soon, July. We can certainly look at that and certainly aim to look at that, because I think we do need to look at lessons learned if we are to make progress going forward, and particularly as the Housing Minister is very keen to address this problem, that I think it's good to look at what hasn't happened in the past that should have happened, so that we can take that forward. So certainly I can't commit 100% to that being ready for his meeting, but we can certainly look at that. But to the final point really is around the GP partner model and the support of GPs in their role, and some of the challenges that they face in terms of whether it's taking on premises, taking on liability. There is definitely a trend where partnership numbers are going down, but salaried GP numbers are going up. And that's often because younger GPs coming forward don't often want to take on the responsibility of being a partner and everything that entails, but very much that partners do feel that by being bought into that practice, they give a huge amount of additional investment in terms of time, in terms of financial investment, and in terms of guidance and development and support for patients. So Secretary of State has instigated the Fuller Review, which will be, not himself, obviously, a GP who's taken on the review around the future models of GP practice, and whether that's partnership, whether that's salaried, whether there's different models available. And we will be taking a good look at those recommendations, because there may not be a one-size-fits-all. Some partners have a very definite view of where they want to go. Others are struggling and need support and help. So I don't think it will be a one-size-fits-all, but the Fuller Review will certainly make some strong recommendations. So I hope in the short time that we've had, I've been able to acknowledge the very main challenges his constituents and his GPs are facing, but hope I've outlined some of the measures we're taking to support primary care and to enable patients to be able to see their GPs more quickly and easily, whether that's virtually or face-to-face.
The question is, this House has considered access to GPs and primary care in North East Bedfordshire. Many of that have been say aye. Contrary, no. I think the ayes have it. The ayes have it. Order, order. The sitting is now suspended until 2:30 p.m.